Mailing Cigna behavioral health claims to a billing address is a dead end. Cigna no longer accepts paper claims from providers, and its denial rate is among the worst anywhere. A 2011 California Nurses Association finding put Cigna's claim denial rate around 39.6%, far above the industry norm. Here is how addiction treatment and behavioral health providers actually get a Cigna claim submitted, tracked, and paid. We cover why paper is off the table, the EDI submission path, the vendor requirements, and how to track a claim through review. The Cigna Behavioral Health Claims address in Chattanooga is for individual members submitting their own member claim form, not for treatment centers. That mailing address belongs to private members filing their own claims. Addiction treatment centers and behavioral health providers should not use it. Cigna directs medical providers, including addiction treatment professionals, to submit claims electronically instead of by mail. Cigna no longer accepts old-fashioned paper claims from medical professionals at all, so a claim mailed to the wrong place simply never enters the system. With a denial rate the California Nurses Association put near 39.6%, every claim you submit to Cigna has to be clean and electronic to stand a chance. A 2018 study found over a third of Cigna members reported a negative customer experience. The friction your billing team feels is real, not imagined. Electronic data interchange submission is designed to screen for coding errors in a way manual paper claims cannot. And Behave Health is built to run that workflow for behavioral health providers. EDI systems can screen claims for coding errors before they go out, and edits can be made electronically without filling out a whole new form. EDI lets billing staff track claims as they travel through Cigna's review process, so follow-up is faster and effort is not duplicated. 4 factors decide whether a Cigna behavioral health claim gets submitted, accepted, and tracked. Let's walk through all 4. Miss any one of these and the claim stalls, gets denied, or never reaches Cigna at all. Step 1. Do not mail the claim. Cigna does not accept paper claims from medical professionals anymore. The Chattanooga mailing address is for individual members only. Step 2. Submit through an electronic data interchange vendor. Cigna uses EDI for all medical plans, employer, government, and privately purchased, not just Medicare or subsidized plans. Cigna's How to Submit a Claim page and its free EDI e-course cover the submission process, when to file, and what counts as a clean claim. Step 3. Confirm your vendor meets Cigna's connection rules. Cigna connects only with billing services that do not charge it for EDI transactions. Eligible vendors must also be EHNAC, HNAP EHN accredited, and CAQH Core certified to be considered for direct connection. Step 4. Monitor the claim as it moves through Cigna's review. EDI lets billing departments track claims through the review process, monitor status, and adjust expectations as needed. If a claim needs a change, you can edit it electronically instead of redoing the entire form. Several EDI vendors are compatible with Cigna electronic claim submissions. These are named in Cigna's vendor list. Availity Gateway Services, Change Healthcare, and Waystar Health are among the vendors compatible with Cigna. Trizetto Provider Solutions, Office Ally, and Experian Health also appear on Cigna's compatible vendor list. The list also includes Eligible Inc., Instamed, Nant Health, PNT Data, SSI Group, and TransUnion Healthcare. Electronic claim submission saves time and money compared with paper billing and removes the faxing that clogs a busy office. EDI eliminates stamps, printer cartridges, paper, and the faxing of forms that burdens a fax-saturated medical office. Screening for coding errors and tracking claims in real time means fewer denials to chase and faster follow-up. Behave Health's revenue cycle management service is designed to handle every component of addiction treatment billing, and we work only for behavioral health providers. The RCM team is designed to support verification of benefits and utilization review on the front end of the claim. It also covers billing and collections and patient responsibility, so claims and balances are worked end to end. And it is designed to support denials and appeals, critical when you are billing a payer with a denial rate near 39.6%. Stop fighting Cigna's denial rate with paper claims. Book a 20-minute demo of behavioral health RCM at behavehealth.com. See EDI-ready claims, tracking, and denials and appeals support built for behavioral health at behavehealth.com.